Hi, everybody. Great to see everybody again, and hopefully we're going to do this in person one of these days very, very soon. But for now, we continue virtual. I'm really, really excited today. This is this event, this town hall today is a little unique. We have some special guests today. We have Doctors Delana Wardlaw and Elana McDonald. What I want to say is these are two of our own. This is two folks from Philadelphia who've done amazing things, very successful doctors. But they, I think what's most exciting about having met with them already is that they really do understand Philadelphia and understand who we are as a city. So just really excited for them to be part of this. They have spent a lot of time and a lot of effort speaking to folks about health and education, about the vaccine and things that have been going on in this city. And they really, really do understand all the complications and challenges that we've been experiencing as an organization and as a staff, and as we work with the families that we work with. So just without further ado, I'm really gonna turn it over to them. I hope if we were in person, we'd give them a little bit of applause so we can do that little thing that we do. And I wanna welcome them and thank them so much for joining us today. And I'll turn it over to you. I do wanna give one reminder before we kick off, that at the end of the presentation, we will, as we always do, we'll have questions. So they'll be doing a brief presentation. We'll have some questions and we will please put them in the chat as we've always done, and we'll make sure to get those questions to them through the chat. Also, at the end, I have a couple brief updates that I want to share with you guys. So please stay with us for those last 2 minutes. I promise I won't be more than 2 minutes after we're finished. But on that note, I'll turn it over to the doctors. Thank you so much for being here with us.
Having us. I am Dr. Elana McDonald. I'm a board certified general pediatrician. I am one half of Twin Sister Docs.
And I am Dr. Delana Wardlaw. I am a board certified family medicine physician, practicing medicine for over 20 years here in the Philadelphia area. And I am the other half of Twin Sister Docs. And Dr. McDonald and I, we have been dedicating our entire career to facing and fighting healthcare disparities that underserved communities and underserved populations experience. And we go by our mission is defined by 3 T's: trust, translate, transform. Trusted messengers that provide accurate, culturally sensitive information, which translate into people being involved and become advocates in their healthcare. And this in turn translates into transformational outcomes. And so we are here today to address COVID and the COVID vaccine. I hope to be able to give you some information to help you become more informed and to help everyone to be able to make a better decision for themselves, their family members, and their community.
That we will get started with the program. What is COVID-19? COVID-19 is a respiratory illness that was caused by a new variant that developed in the end of 2019. We also call it SARS-CoV-2, and the active portion of SARS-CoV-2 is a spike protein, and that allows the virus to infect people. The virus is spread through close contact. It's spread through droplets. So what that means is it's spread if you're just talking, if you're sneezing, if you're coughing, if you're laughing, if you're singing. Those are all ways that the virus is spread. Some people have symptoms such as cough and runny nose, but some people don't have any symptoms at all. So that's what we call asymptomatic spread, which is what has made this virus so deadly also. We know that people who are elderly and those with chronic conditions seem to have more complications from COVID-19. So that is just the gist of COVID-19, how it spread, where it's come from. We do know that the impact of COVID-19 has been global. It was declared a global pandemic around this time last year in March of 2020. And to date, globally, over 120 million people have been infected. 2.8 million people have died from COVID-19 across the world. In the United States alone, over 30 million of us have contracted COVID-19, and over 500,000, so 500,000 of us have died from COVID-19 itself. Over 3 million of our children have been affected with COVID-19. and over 40,000 children have lost their parents to COVID-19. In 2020, COVID-19 became the third leading cause of death for Americans, behind heart disease and cancer. We also learned that COVID-19 has disproportionately affected African Americans and Latinos. Dr. McDonald, Dr. Wardlaw, could you go over the symptoms, the signs and symptoms of COVID-19?
Yes, so COVID-19 can present as a chameleon. It can come in many forms, as fever, cough, difficulty breathing, headaches, loss of taste and smell, diarrhea, extreme fatigue, unusual rashes, and as Dr. McDonald mentioned previously, you can present without any symptoms at all, being asymptomatic. And that is why it is so important for us to get control of this condition this disease, because many people carry it and not aware that they have it. COVID-19, we know, can cause many complications, including pneumonia, respiratory failure requiring people to go on mechanical ventilation or ventilators, kidney failure requiring dialysis. People have strokes, people develop blood clots to their lungs, also known as pulmonary embolisms. Children can develop the multi-inflammatory syndrome that Dr. McDonald has spoke of. And as mentioned, a half a million people have died from COVID. We do have some treatment therapies that have been used for COVID as we have gone through this year of the pandemic. Many of the treatments are geared towards treating the complications, antibiotics for pneumonia, oxygen or the ventilator for people whose lungs have failed, dialysis for kidneys who failed, blood thinners for people who have had blood clots. We also know that there are some antivirals that are available, remdesivir, steroids are sometimes used, monoclonal antibodies have been used, and also convalescent plasma has been used, and that is when the antibodies from patients who have recovered from COVID are used to treat patients who have not recovered. Dr. McDonald, I'll turn it back to you to talk about the devastating impact of COVID on our communities.
Yes, as we have learned a lot about COVID-19, including symptoms, including treatment plans, but one thing that we did learn about COVID-19, which really was no surprise, was the devastating impact that it had on African Americans and Latinos. African Americans and Latinos are 3 times more likely to be hospitalized and die from COVID-19 than other ethnic groups. And we do know that COVID-19 simply just unveiled a lot of things that have been going on in the country for hundreds of years. So African Americans and Latinos have been disproportionately affected due to a long-standing history of systemic racism, which has led to socioeconomic disparities, healthcare disparities, educational disparities, lack of access to adequate healthcare on a consistent basis, something called implicit bias. And when we speak of implicit bias, it means that if African American goes into the hospital for a treatment plan, their treatment plan may not be the standard of care based on assumptions that people make based on their race. We know that there's a huge distrust of the medical establishment based on events in history and even current events. So though all those things combined together has led to the devastating effect of COVID-19 on African Americans and Latinos.
So why are we here today? The main thing is to talk about vaccines and vaccination. What are vaccines and what do vaccines do? So vaccines have been developed, and vaccines have been around for many, many years. The first vaccine was developed in 1796 against the smallpox virus. And the vaccine, your immune system works off of a memory. If your body or your immune system sees a disease, it will develop antibodies to allow you to protect yourself against that disease if you see it again. The vaccine has been formulated, or vaccines have been formulated to allow you to be exposed to certain conditions without actually seeing the true disease itself, so that your body can develop a defense system and make a memory cell so that the next time it sees it, it will be ready to fight it. So let's just put that in easier terms. So Dr. McDonald and I, we are on 2 opposing basketball teams. And so I am the Temple Owls and she's the Villanova Wildcats. And we're showing up to the championship game in the NC2A tournament. However, I have the Villanova Wildcats playbook. So when the Villanova Wildcats, they're able to step onto the court. However, their offense is not going to be nearly as effective because I know exactly what to do to defend whatever shots they're going to put up. And that's what the vaccine does. It gives you a playbook to any disease process or to a disease process without you seeing it. So with the COVID vaccine, the vaccine allows you to be exposed to a COVID spike protein without seeing the actual virus, the real virus, so that if it does show up in the future, your body is ready to defend against it. Now, vaccines in general, the purpose of vaccines is to decrease the severity of disease and death. I thought I heard an echo. I'm sorry if it's echoing. To decrease severity of disease and death, in order for a vaccine to be used in humans, it has to go through safety trials and efficacy trials to make sure that the vaccines are, one, safe, and two, that they are doing what they're supposed to do, decreasing severe disease and preventing death. With any vaccine, or any medication for that matter, the benefits must outweigh the risk. The benefits must outweigh the risk. Any potential side effects of the vaccine cannot be worse than the potential complications of the disease we're fighting against. Vaccines are tried and true. We have seen many diseases that vaccines have been effective against fighting. Chickenpox, also known as varicella, measles, mumps, rubella, polio. We've seen a variety of diseases where the vaccines have been very effective at fighting against those diseases. We do know that when vaccinations are scaled back, we did see some scaling back of vaccinations a year or two ago, and there was a measles outbreak on the Temple University campus. And so this shows that vaccines are very effective, and they serve a purpose in trying to defend against severe complications and death from particular diseases. Dr. McDonald, I'll let you go over start with the Pfizer vaccine.
So to date, we have 3 different vaccines that have been approved to help fight the COVID-19 virus. The first vaccine that was approved back in December was the Pfizer vaccine. Pfizer vaccine is a 2-dose vaccine that's given 3 weeks apart for persons 16 and above. And the active ingredient in the Pfizer vaccine is what we call mRNA. mRNA is also known as messenger RNA. And people will always ask, well, how does messenger RNA work? So remember, the vaccine, the mRNA is developed in the vaccine, and the mRNA is essentially giving the body instructions to make the spike protein, which is the active portion of coronavirus. And once the body makes the spike protein itself, the immune system recognizes it as foreign, and it starts to develop its antibodies to mount a defense against coronavirus if you actually see it in the future. The Pfizer vaccine had to go through clinical trials. The clinical trials proved that the Pfizer vaccine was 95% effective. And in that trial, the Pfizer vaccine, they had over 40,000 participants in that vaccine, including 13% Latinos and 10% African Americans, 6% Asian, 1% Native American, and the remainder were Caucasians. Again, that vaccine, the data from the vaccine was evaluated by an outside agency, which showed that the vaccine was 95% effective. To date, we know the vaccine was started to be given back in December. There's no evidence that immunity is starting to wane as we continue to study the data. The other ingredients in the Pfizer vaccine, in addition to the mRNA, which is the active portion of it, is something called lipids. And lipids is kind of like a fatty molecule that allows the mRNA to enter the cell, the vaccine to enter the cell. And then you also have salts and sugars, and those are there to keep the vaccine stable so that it doesn't break down. Once it enters, once it's being transported, dealing with extreme temperatures, those are the ingredients of the Pfizer vaccine.
And I will talk about the Moderna vaccine. The Moderna vaccine is the other mRNA vaccine that we have available. It is a 2-dose vaccine that is given 4 weeks apart, and it is given to patients 18 and above. That vaccine was shown to be 95% effective when the vaccine was rolled out at preventing severe disease and death. 30,000 participants, volunteer participants, enrolled into the study. 20% of those participants were Hispanic, 10% were African American, 4% Asian, 1% other, and then the greater than 60%, of course, were Caucasians. The ingredients of the Moderna vaccine, again, is a messenger RNA vaccine, is the active ingredient of the messenger RNA that delivers the instructions to your cells to make the spike protein without seeing COVID. There's no COVID virus in this vaccine. I'll say it again, there isn't any COVID virus in the vaccine. There's also the lipids that Dr. McDonald talked about. There are the salts, there are the stabilizers that are there to help to maintain the integrity of the vaccine. And all the vaccine ingredients are readily available to everyone, and they are on the CDC website. Johnson & Johnson is a vaccine. It's a single dose vaccine, which is different from the other two vaccines that we've talked about. Now, Johnson & Johnson vaccine is called a viral vector vaccine, where it uses an inactivated form of another virus, the adenovirus, which is it causes the common cold, but it's in an inactive form, so it cannot replicate and it cannot cause any problems within the body. Well, that virus is very effective. That inactive form of the virus is very effective at delivering the message through the vaccine to your cells to make the spike protein again without seeing the actual COVID virus. So you get to the same destination by two different routes. You can either go 76 or you can go over to the bridge to get to a specific destination, but both get to the same, to the sports center. It's just two different routes that you take to get there. The Johnson & Johnson vaccine had over 45,000 volunteer participants. Again, no one can force you to sign up for a vaccine study. Consent has to be given. So 45,000 people voluntarily participated in this vaccine trial study. It has shown to be 72% effective against moderate to severe disease, but it has also been shown to be 85% effective against death and hospitalization. So the vaccines have been shown to be very effective at decreasing disease severity, as well as decreasing death. So remember, even if you get the COVID vaccine, there's still the potential that you can get COVID, but it'll be a milder form, and you will not wind up in the hospital on a ventilator or fighting for your life or even dying. So it's just like that game we talked about. I have the game plan. Villanova will be able to show up. They'll be able to get onto the court, but they're not going to be successful at all at winning the game because I know how to defend against it. Dr. McDonald, you want to talk about vaccine safety?
Yes. So vaccine safety, there's lots of questions around the safety of the vaccines. And as Dr. Wardlaw just mentioned, any vaccine or any medication that is rolled out to the public must go through what we call clinical trials. And clinical trials are 4 phases. Oftentimes we hear about the 3, but we'll also talk about the 4 phase 2. So the first phase of the clinical trial usually involves less than about 50 healthy volunteers who are enrolled into the trial. And the first phase is to determine if the vaccine is actually safe to give to people. Once that's determined, then they roll over to phase 2, when there's a couple hundred people in the trial. And that's to make sure to look at to determine proper dosing of the vaccine and also see if there are some other side effects that's coming along. Phase 3 involves tens of thousands of people where you really want to see if the vaccine is truly effective in fighting off the disease. Right now, we're talking about COVID-19. So during that trial with tens of thousands of people, some people will receive the actual vaccine, some people will not receive the vaccine. However, at the time when they receive the injection, the person given the injection and the person receiving the injection do not know what they're actually receiving at the time. Once they have that data is analyzed by the pharmaceutical company, but also is analyzed by an outside company to determine the true effectiveness and safety of the vaccine. Then phase 4, what we often talk about is once we give a vaccine, it's still important to follow up with people who receive the vaccine to see if there are any significant side effects or long-term effects that we may see later on. So that's what we consider phase 4 of the vaccine. Always, the key thing about vaccines, if you are going to offer a vaccine to any community, any person, the benefit of the vaccine must outweigh the risk of the disease.
And with that being said, we will go over the potential side effects of the vaccine. So we do know that if you get a vaccine, you can develop potential side effects, and those side effects could be anything from headaches, lightheadedness, dizziness, soreness at the injection site, fatigue, body aches, low-grade fevers. And then we have to compare that to the potential complications of COVID, being what we have discussed earlier: acute respiratory failure, winding up on a ventilator, the lungs failing, inflammation of your heart, heart attacks, strokes, blood clots to your lungs, and death. And if for patients who are fortunate enough to survive COVID-19, there's also the potential of developing long-term side effects. We see long-term inflammation of the lungs where people are requiring long-term use of oxygen that they didn't require before. But we see inflammation of the heart where patients can develop significant inflammation of their heart and develop abnormal rhythms of their heart. We also see that people have some issues with cognition and memory and being able to remember things. And so we are also noticing that those who are fortunate enough to survive COVID, also there's the potential of long-term side effects that we have to deal with as well. So again, the risk of the side effects of the vaccine versus the potential complications of COVID. Now there's always this question of, and one thing I just want to go back to is we also have to be aware of identifying side effects of the vaccine, which is what I just talked about, and then adverse reactions of the vaccine. And so adverse reactions, we have heard of some allergic reactions where patients develop a significant reaction, and they may have had some allergy issues in the past, or they may have been EpiPen carriers in the past, and they develop a significant systemic reaction where their body, the entire body becomes affected, and their blood pressure drops. They have an increase in their heart rate. Sometimes they could develop some difficulty breathing. Those are adverse reactions which usually develop shortly after the vaccine is given, and that is why it is very important for patients to be monitored after they are given the vaccine. So when you go get your vaccine, for those who have gotten it and for those who are contemplating on getting it, you will be asked to sit in a waiting area after you get your vaccine. 15 minutes for those who have not ever had any allergies, and 30 minutes for those who've had potential allergies in the past. So we do want to make sure that people are aware of that as well. And another question that always comes up is, how did this vaccine come to market so quickly, quicker than other vaccines? Well, one, Operation Warp Speed, I wasn't too happy about the name because it made it seem like things were done in a quick fashion, and that gave people an idea that sometimes all the bases weren't covered, and that did not happen at all. But Operation Warp Speed was an operation that allowed everybody in the world to drop what they were doing to focus on the COVID vaccine, because it has affected everybody globally. And so normally when you have vaccines developed, there's usually one manufacturing company that develops the vaccine, and you have to go through each step individually. Well, you had several different government organizations, private organizations, hospital organizations working together across the world on this vaccine. So one that allowed many steps to be done simultaneously, instead of each step having to be done by that one individual company. So that cut away some of the time. But two, even more importantly, is messenger RNA was not just developed last year. Messenger RNA that technology has been being worked on for several years. Messenger RNA has been being developed and researched for well over the last 10 years. We have seen it has been used in the development of other vaccines. We've seen it used with the Zika virus, it used in that development of that vaccine, and rabies and Ebola. However, this is the first time that the vaccine will be using the actual mRNA, but it's not new technology. The technology is not new. It just didn't develop with COVID-19 when it showed up on our doorstep. And then 3, also, vaccine technology has improved, just like our cell phones have improved and all of our electronics have improved, and life improves as we go through the years and through the decades. So vaccine technology has improved as well. And that also allows some of the time to be decreased. However, with keeping intact safety guidelines to make sure there aren't any safety protocols that have been abandoned during this process. Another thing I would like to mention is there is, some concerns about the vaccine, timing, and, why should African Americans participate in getting this vaccine? Well, African Americans are at the table on this vaccine. Dr. Kizzmekia Corbett, she was one of the lead scientists on the development of the Moderna vaccine. Many of the historic Black universities and institutions and hospitals have been involved in the development and distribution of the vaccine. The National Medical Association, which is the organization of African American physicians, have been watching the oversight of this vaccine, the Black clergy, the National Black Nurses Association. So we are involved. We have a seat at the table to make sure that this vaccine has been developed appropriately and is being distributed in an equitable and safe manner.
And just to piggyback on what Dr. Wardlaw was just saying, as far as the development of the COVID-19 vaccine, remember this is SARS-CoV-2. SARS-CoV-1 came out in the early 2000s, when we saw the MERS and the SARS epidemic then. So that was SARS-CoV-1. So when SARS-CoV-2 came out, once they learned the genetic code of SARS-CoV-2, which was extremely important to develop the vaccine, they were able to start to just pick up where they had left off when they started to work on some things in early 2000s with the SARS-CoV-1 epidemic.
Okay, so again, let's keep going down this road of vaccine safety. Again, we already talked about the concerns of, timing and the safety protocols that the vaccine has to go through to make sure that it is safe, that it is doing the job that it's supposed to do. Dr. McDonald and I, we understand that history has not always been nice. The government has not always been nice to African Americans and Latinos. We are aware of this. We do know that because of historic events with the Tuskegee experiment and with the use of Henrietta Lacks's cervical cancer cells without her permission. We know with the Holmesburg dermatology experiments, we know that these things exist, and we understand the hesitancy sometimes that it may cause, and we understand that it may allow us to ask questions and to be able to question why should we even participate. The reason we need to participate in getting vaccines is 1, COVID is now a preventable death. It is a preventable death. 2, COVID is, in 2020, it was the 3rd leading cause of death in the United States. 3, African Americans and Latinos are disproportionately affected by this virus. So we have to do something to change that narrative. And the vaccine is the most appropriate step to do that. Now, I also would like to dispel some myths. As we mentioned earlier, there's not any COVID in that vaccine when it's administered to you. No active COVID virus in the vaccine. That is why the vaccines are so effective. They allow you to actually see the COVID protein without seeing the actual disease itself. So no COVID in the vaccine. 2, it does not alter your DNA. 3, does not alter your fertility. 4, there aren't any tracking devices. 5, there aren't any known negative effects on pregnancy. In fact, the recommendation is that pregnant women consider the vaccine, or that the vaccine not be withheld from pregnant women, because the effects of COVID on a pregnant woman can be very devastating, and it can cause preterm labor. It can cause patients to be admitted to the ICU, can cause significant complications. And we have seen patients die of COVID. And then we have newborns that don't have their mother. We have newborns who we have pregnancies that don't make it to full term because they go into preterm labor. So the complications of COVID are far more significant on the pregnancy than any potential side effects. And we have not seen any negative side effects on the vaccine from pregnant women. And I think the question may come up, because we've heard this previously, is, well, it wasn't tested on pregnant women. However, there were some pregnant women who were enrolled into the study. They weren't pregnant. They weren't known to be pregnant at that time, but they got pregnant during their enrollment into the trials. And they have since been reporting the experiences, if they've had any side effects. So now we are getting that data of pregnant women who did actually receive the COVID vaccine, even though that wasn't the intention in the beginning. So yes, this is why we need to consider this vaccine, strongly consider this vaccine. And Dr. McDonald, let's talk about the variants.
Any virus has the ability to what we say change or mutate. And when we say mutate, it means that they may change their shape, they may change something about their structure in order to survive. When that structure changes, the virus can become more deadly. The medications used to treat it may not work. And that's what we call variants. And we have seen quite a few variants that have led to increased transmission out of the UK, Brazil, South Africa, India. We've seen those variants. And when we see variants come up, we're always looking at, okay, how does this new variant of the coronavirus, how will it affect us? What will be the effect on humans? We do know that these variants spread more rapidly. All of these variants have made it over to the United States. So we know that it spreads more rapidly, and we do know that some of the variants can have more significant consequences. So we're constantly looking at those variants. To date, the vaccine is still effective against the variants. So it's very important for us to stress that the vaccine is still very important against the variants based on the data that we have today.
And that's why it's important for us to continue the monitoring or surveillance of the vaccines, even once people have received the vaccine, because again, we have to make sure that one, is still safe. We have to monitor any adverse side effects that may develop. And two, we have to make sure that it is still being effective against the variants. And say, it turns out that we're starting to notice that it's not effective against the variants. Well, we may have to get a booster vaccine, or it may be a seasonal vaccine that we may have to get. And this isn't anything new. We've seen this before. We see it every year with the flu shot, that we have to get a seasonal flu vaccine. So scientists and the medical establishment is prepared to deal with that. But to date, the vaccines are still effective against the COVID variants.
One way to decrease the variants is to decrease the number of hosts that the coronavirus can spread to. And when we say hosts, we mean humans. And the more people that get vaccinated, it will decrease the opportunity for the virus to mutate and lead to more and more variants. So that's why it's important for as many people to get vaccinated as quickly as possible.
All right. So in general, just some takeaway points. COVID-19 has had a devastating impact on the world, has had a global impact. And the United States has been bearing the brunt of that disease, unfortunately. And here in the United States, African Americans and Latinos are affected at disproportionate rates. We have learned that, as we continue our mitigation efforts, and we still need to continue those with hand washing and social distancing and wearing our masks, it has not been enough. Again, COVID is a preventable death now. One more death is too many. So we really have to strongly consider, again, now in 2020, it was the third leading cause of death behind heart disease and cancer. We have to strongly think about that. The vaccines have been proven to be safe and effective. We know that people are concerned about the long-term data. However, we can't rush the clock. What we do know that the short-term data has shown that the vaccines are safe and effective, and we will continue to monitor for long-term data. But what we do know is that COVID has killed 500,000 people, over 500,000 people, 500,000 people. So we really need to attack the elephant that's in the room, and that is why we have to strongly consider these vaccines.
Other take-home points with the vaccines is, as a pediatrician, I've been giving vaccines in my office every day for the last 20 years. Typically, you do not see long-term side effects from vaccines outside, the immediate time that you give the vaccine. if you're going to see those effects, typically you're going to see those within the first few days, if you're going to see any side effects. However, we'll continue to study that data. And I know people want long-term data. However, time is just not on our side. In 12 months, this virus has shown us and continues to show us how deadly it is. This virus is not on the other side of the world. This virus is in our homes, is in our schools, it's in our churches, it's in our places of recreation. And at this point in time, most people either know someone who has COVID, or they know someone by way of another person who knows them directly who has actually died from COVID-19. So this pandemic has been devastating across the board. And if we want to try to return to some sense of normalcy and get on the other side of the pandemic, then we need to strongly consider the vaccine. We want to send our children back to school. We want to send them back to college. We want to be able to go to their sporting events. We want to go to professional sporting events, churches, restaurants, weddings. We want to be able to go visit our grandparents and our elderly parents. The vaccine will allow us the opportunity to do that. So we want to make sure that you have the accurate information so that you can make the best decision for you and your family. Speak to a trusted messenger who understands the science, who understands the data. Speak to your doctor who understands your specific medical conditions, who understand your social conditions, and that way will allow you to come to the best decision possible.
And I would just to add one other thing. So Dr. McDonald mentioned that side effects are usually seen within the first couple of days of the vaccine, but adverse reactions, we talked about the difference between side effects and adverse reactions, those are usually seen within the first 2 to 3 months of vaccine administration. So again, the studies and were scaled that time frame. So again, that is why these vaccines have been rolled out and been distributed to the world. And with that, we would like to say thank you, and we will open it up for questions.
Yeah. And before questions, in full transparency, Dr. Wardlaw and I have both been vaccinated. I received the Moderna vaccine in December, and I got my second shot in January. And Dr. Wardlaw received the Pfizer vaccine in December and January also.
Yes, absolutely. And we wouldn't encourage anything or recommend anything to the general population that we wouldn't recommend to ourselves, our family members, and to our close friends. So thank you for giving us your time today.
Thank you both so much for your presentation. We do have some great questions here in our chat. The first one, can you talk about the vaccine effectiveness for those under the age of 16?
That's what they are studying now. So right now, what we know is, as a pediatrician, I always say that children are not little adults. So they had to continue trials in children to make sure that the vaccine is still just as effective and as safe in children. Now, preliminarily, Pfizer is saying that its vaccine in children between 12 and 15, that the vaccine is 100% effective. Now, that data has to be analyzed even more, but they're still running trials to determine how effective the vaccine will be in children. And there are also trials that have been started with Moderna as young as children as 6 months. Trials have recently started. So I would say stay tuned for that data as we wait for that data to become available.
Great, thank you so much. We have a few questions about boosters. Can you tell us a little bit about if we know if we'll need the boosters, or if there's any data on or estimate on when?
So for the boosters, we're still following data. Pfizer did come out and say that their research is showing that their vaccine protection shall last approximately about 6 months. So, and again, that research all has to be verified and clarified, as Dr. McDonald and I discussed. The company itself is not just the ones who review the data, so that is, reviewed by the FDA and the CDC and AICP to make sure that the information is accurate. So it's a possibility that we could very well need a booster dose to boost the immune system again. Absolutely. But that has not been that decision has not been made to date.
Thank you.
Mhm.
Now we have, is it safe to not wear masks around individuals that have also been vaccinated in the same home?
Is it safe to, so if I'm hearing you correctly, can you go without a mask if other people in your home have been vaccinated?
Yes, in the same
Yeah.
home.
Yes, you can go without your mask. But if you're going to go outside or if you're going to go to other homes where people haven't been vaccinated, please do wear your mask.
So if they are not vaccinated, people should still wear masks.
Absolutely. Mhm.
Great, thank you. All right. And then we have a question, is one vaccine better than any other?
No, the data
No.
has shown that these vaccines are extremely, extremely effective. So our recommendation and the overall recommendation of the medical community is whatever vaccine is available to you, we recommend that you get that vaccine.
Thank you. If you've already tested positive for COVID and recovered from mild symptoms, should you still be vaccinated?
Yes, the recommendation is that you still get the COVID vaccine. We do know that the natural immunity is not as strong as the immunity from the vaccine. So we do recommend that those who have had COVID get the vaccine. If you receive treatment from COVID, there is a 90-day window that you have to wait to get the vaccine. But yes, it is recommended that despite having a positive, being COVID positive, you should get the COVID vaccine. Absolutely.
And speaking to what Dr. Wardlaw was saying, is natural immunity. So again, once you actually see a disease process, your body has now mounted those antibodies and you are considered what we call immune. However, with COVID, because this particular COVID-19 virus is so new, we do not know how long that immunity will last. We don't know if it's 60 days, 90 days, a year. So that's one reason why it's recommended that you get the COVID-19 vaccine. And two, we know that the immune system is much more responsive to the vaccine than the actual disease itself.
Great. And will taking the shot for COVID, is taking the COVID vaccine going to be as generic as the annual flu shot, do you think?
That's a possibility. Again, we are continuing to watch the research and watch the data. But if the variants, COVID has been showing that these variants are appearing. And again, there have been several COVID variants. However, we've had these 4 that have emerged that have had some significant impact. However, has not evaded the vaccine just yet. So we don't know. The jury is still out. We stay tuned. We're still watching. But there is a chance that could be the recommendation. Absolutely.
Great. And then we have another question here saying that they believe the vaccine is effective for a certain period of time. What do you think might happen if COVID-19 is not eradicated by that future point in time?
We'll need a booster vaccine. We'll need a booster. Absolutely.
If the data is showing that the virus continues to be transmitted at a high rate, and we're not able to decrease the transmission with just the vaccines that are out now, then it will likely require a booster down the line. And those are all the questions that we don't quite know the answers to yet, but it's important to keep studying the data.
And not only decrease transmission, but also to decrease the disease severity and death. Again, we have to keep that in mind, decrease disease severity and death.
All right. Thank you. Are those who have been vaccinated still able to be carriers of the virus?
Yes, absolutely. So again, we have to make sure that if you go around somebody who's not, has not been vaccinated, it's still very important for you to wear your mask. Absolutely.
And are these
I'm sorry, just to piggyback on what Dr. Wardlaw was saying, again, one of the key goals of the vaccine is decreasing the severe symptoms and consequences of the disease. So, but you can still potentially contract the COVID virus, and you may be asymptomatic and may pass it off to someone else. So that's why it's still important for people who everyone, if a majority of people are still not vaccinated, we should still be wearing our masks.
Mhm.
Great. And are these vaccines safe for advanced cancer patients to take? Do we know?
So the vaccine has been proven to be safe, and we have not seen any adverse side effects. We do know that cancer patients are at higher risk for complications and death if they contract COVID. Now, the vaccine, if a cancer patient is on a immunosuppressant drug or on chemotherapy or on a medication that is being used to treat their cancer, but is also weakening their immune system, these patients may not have the robust vaccination response that we are, or antibody response that we would see in somebody who's not receiving those type of treatments. But it does not have any effect on the cancer itself.
And in general, we always encourage anyone who has such chronic conditions to discuss it with their physician.
Thank you. And our last question here, if you continue to have side effects from the vaccine, how long after is that normal to have side effects, or like when should people be concerned if they continue to have side effects?
So any side effect, there is the vaccine adverse reaction reporting system. So we encourage people to make sure they report their side effects there. We also make sure that you discuss it with your doctor, because again, vaccine side effects typically should not be, in general, should not be going on for more than about a week or so. Most people, the side effects are gone within 48 to 72 hours, but if this is going on for more than about a week or so, definitely contact your physician. And please make sure that you're reporting these side effects to the vaccine adverse effect reporting system, also known as VAERS.
Great, thank you. And Tony, I think that may be all of our questions.
Well, thank you so very much. This has really been awesome, and I know that I'm seeing a lot of thank yous also in the comments as well in the chat. So you're getting a lot of thank yous from the folks who are online with us. So this has really been amazing. I really do appreciate so much you guys are doing for the community right now, particularly trying to get this word out and supporting people with education and information. It means a great deal, and I really do appreciate it personally for what you've done here for CCTC today. So thank you so much. Please, everybody, hold on for 2 minutes with me. But I just want to say thank you to the doctors, and so much. Hopefully we get to do something else with you guys soon again. I'm looking forward to that.
Great, and thank you to everyone for taking the time to come and get accurate information to help them make a decision.
Absolutely, and thank you for having us.
Thank you.
Thank you.
So for everybody else, I just want to let you know you're going to be getting an extra notice. We're going to be having an extra town hall during this month of April because we had the opportunities to bring the doctors on board. We wanted to make sure we continued with our general update. So the next town hall, I do not think we have a date firm yet, right? I see the nodding heads, that's good. But it will be focused on re-entry plans and our schedule for the spring, summer, and fall. So we're going to be talking a lot about what the spring, summer, and fall is going to look like and what our plans are for that. So please join us. It's really important in conversation, and we do want you to come with your questions. We will try to get a lot of that information out to you ahead of time. Between now and then, there will be one communication that will be coming out this week about some of that re-entry information, and more will be coming. So thank you, everybody. And really, I hope you have a great rest of the week, and look forward to seeing you soon. Take care.
Tony, can I just say one last thing? I'm sorry, just a reminder to everyone, after this great presentation from the doctors, we are having a vaccination event on Wednesday, April 14th. There are slots available, so if you are interested in being vaccinated, please reach out to me and I can get you scheduled. It is the 2-dose Moderna, so you will get the first dose on April 14th, and then you will automatically have that second dose scheduled on May 12th for the same time appointment as the first one. So if you're interested, reach out to me and I'll get you scheduled. Thanks, Tony.
Thank you. Have a great week, everybody. Take care.